Debbie Goeller was Worcester County's health officer and trusted public health leader for over 25 years. Her vision and what she accomplished over her years of service continue to shape the future of Worcester County Health Department. Her persistent and focused leadership paved the way for new programs and specialty services that continue to be offered by the health department. She was a champion for public health services, and her dedication to the citizens of Worcester County was unwavering. In 2020, the Debbie Goeller Excellence in Public Health Award was created to recognize exceptional performance by individuals identified by their peers for having excelled in public health with integrity and a strong commitment to the community and population health of Worcester County. At this time, I'd like to recognize someone very special to the health department family. I'm so very pleased to share this podium today with Debbie's daughter, Mandy, that we call her Goeller. Even from the West Coast, or from a boat somewhere out in some ocean or body of water somewhere, Mandy has always been a part of this annual award. As many of you know, Mandy has been with the National Oceanic and Atmospheric Administration, or NOAA, for over 20 years. It is my great pleasure to introduce, get ready for this, Rear Admiral Goeller, Deputy Director of the National Oceanic and Atmospheric Administration Corps and Deputy Director for Operations for the NOAA Office of Marine and Aviation Operations. The apple doesn't fall far from the tree with your mom. So everyone,
Good morning.
Good morning.
So first, thank you so much. Thank you, Becky, for that introduction, which was too much. I wore the uniform in hopes that I would not cry. And now, thank you, I'm already crying. So I have a little tissue. In my new role, I do a lot of public speaking, and when Becky said there'll be over 200 people, I thought, no problem. And I am clearly a lot more nervous than I thought I would be, as I just spilled my water basically on my husband. So thank you, husband. So Becky also told me that I had to keep the winner a secret still while I spoke. So I figured this year, since I do secretly know who the winner is, that I would have a really hard time not giving it away. So for this year, I'm going to instead take a little bit of a different tactic and talk a little bit about my mom specifically, if I can get through it, what it means today, and why this award exists and why it would mean so much to her. So I would say that my mom was everybody's biggest ally, cheerleader, and truth teller. I always joke, I said if I wanted someone to tell me how great I was, I would have called my father. If I wanted somebody to tell me the truth, I would call my mom. There's at least three core qualities that she embodied that I think this award showcases. Strength to do what is right, even when it is the hard thing to do, and strength to always make the right call. She had empathy before we probably really understood what empathy really meant, right? She had the way of being able to put herself in everybody's shoes and understand what the community needed and what her workforce needed. Mentorship. That will be very evident today. It meant a lot to her to see all the people that she worked with and that worked for her continue to thrive and do great things for the community that she served and the entire state. So thank you all for everything that you do every day. I've been fortunate that I've basically known every single one of the previous winners. Of course, one caveat that it was the entire health department for the COVID year, so I maybe didn't know everybody at the health department, but I had a lot of connections to every single winner. And I think what that showcases is that my mom had this special ability to blend work and life, and not in a way that was against work-life balance as we talked about today, but just in a way that she so strongly cared about the community that we were all always part of it. So we always ran into people, we knew everybody. She made it a very key component of our lives to stay connected between work, community, and our own family as well. She would have hated this attention, I will say that. We have found so many awards that my mother has received. In fact, I still have a key to Ocean City. I'm keeping that one. And she didn't always put them up because she cared more about the work. She felt like it was the work of the people of Worcester County and the people of the health department here rather than herself. But what she would have loved is the awardees being recognized. That she would have loved. She also would have loved to see that public service is still within our community and that public health is thriving. So my mom instilled in me a life of public service, self-evident in my position today. But she did this just by doing, not by telling. She never told me what she thought I should do growing up. She never told me what she thought that I should continue a life of public service. But the way that she brought that out in me is very self-evident. So to all of you, and probably some new faces in here that maybe had not even met my mother, but she was Debbie, and to me, she was Mom, but for all of us, we always got the best of her. So I'm unbelievably honored to be able to be here today, and now we get to see who's won.
Thanks so much, Mandy. All right, so give me a minute because I'm going to read to you this submission, and I'm going to do my best to keep the name out until the very end. So this person has devoted nearly the past 36 years to serving in the public health arena. With a career that began in 1989, maybe before some of y'all were born, has provided direct service to individuals with behavioral health and case management needs, supervised and provide leadership and guidance, created and facilitated a vast array of programming, trained and taught, and inspired multiple generations of public health servants and helpers. It is difficult to find these people or public health professionals on the lower shore who hasn't partnered with, supervised, or impacted in some way. This person has long believed in and proclaimed the importance of partnership. With an often affable personality, simultaneously assumes the role of the comfortable and unassuming native of their county, putting others at ease while also being a commanding and well-informed presence in any room. Over the course of this person's career, this person has forged relationships among public health agencies, state agencies, private agencies, consumers of public health services, educators, etc. And other things, this person has integral in the formation and function of the Worcester County Youth Council, which operated for a number of years and brought together agencies that serve or educate Worcester youth, as well as youth themselves, acknowledging that the voice of those who we serve needs to be heard and that they deserve a seat at the table as the experts of their own lived experience. This person has always been a proponent for those in need of public health services and was tackling social determinants of health long before that was well-known buzzword that it is now. For the majority of this person's career, it's been primarily focused on case management services. As a supervisor, this person was known for making staff utilize public transportation so they could really understand the difficulties that our clients face and be able to respond with empathy and true understanding. This person was integral in starting the mentoring program, understanding that youth in unproductive free time are more likely to make bad choices. That program helped youth with legal issues find positive uses of their time. This person facilitated, supervised, or directed programs that helped to ensure that the citizens and visitors of Worcester County and beyond have access to food, housing, assistance with utilities, transportation, insurance. When the Affordable Care Act was signed into law, this person guided his team in starting up the Lower Shore Health Insurance Assistance Program, the regional connector entity for Maryland Health Connection. Hearing that alongside our MCHIP and our ACCU, this person was a leader in ensuring those on the Lower Shore had access to affordable and comprehensive health insurance. Acknowledging that people aren't able to access basic health services if they are uninsured or underinsured and can't afford them. In addition, this person has been a champion of the local medical assistance transportation program, working to remove the transportation barrier that so many face so that they can receive the care they need. At the heart of it all, this person has always understood and promoted access as a key component of public health. In 2018, this person took on the daunting task of merging case management and our behavioral health units within the department. In this role, he worked to finalize the transition of substance use disorder treatment services out of the grant realm and into the realm of fee-for-service. That wasn't an easy task. As the nation was gripped by the opioid crisis, this person again sought ways to innovate public health to the best serve the needs. This person led his leadership in developing and locating funding for the Emergency Department Care Coordination Program, placing behavioral health staff within our emergency department at AGH. This person also spearheaded the efforts to develop a high-risk team, which began meeting weekly to review cases at high risk of overdose and to ensure that all available services were put in place. Through these projects, this person was continuing to promote access to care for all, encouraging a no wrong door concept, and furthering the notion that in the world of public health, we don't sit back and wait for those in need to come to us. Rather, we integrate into the community, meet people where they are, and provide services to prevent or treat health concerns in a holistic way. It is that philosophy of meeting people where they are, treating all the community members with dignity and respect, and proactively and creatively finding ways to meet the health-related needs that this person has also spent a career teaching to those around him. Whether it is through formal or informal supervision, work with interns, continuing education trainings, or hosting weekly supervision for those seeking advanced licensure, this person has tirelessly lived out the value of developing the next generation of public health professionals to have a passion for their work, to always seek innovative ways to meet the public health needs of the community and to ensure that everyone has access to the services they need. Ladies and gentlemen, if you haven't figured it out yet, please join me in congratulating the 2025 Debbie Goeller Excellence in Public Health Award to Mr. Eric Gray.